Accessories. When you receive the machine, the following accessories will be included. High-pressure oxygen hose. High-pressure nitrous oxide hose. High-pressure air hose. Oxygen sensor. Facial mask. Screw tube with Y connector and director connector and air storing bag. Silicon screw tube. Fuse. Power line. Castor. Manual instruction. Structure. 10.1-inch color touchscree. Operation panel. Standby button, click to return to standby mode. Mute button, silence the alarm. A 120 seconds countdown will appear on the screen. Parameter setting button, setting parameters under each ventilation modes. Menu button, system setting. Cancel button, cancel previous step operation. Adjust/confirm knob, adjust parameter values and confirm. 5 tubes, mechanical flow meter for air, nitrous oxide and oxygen. Flow meter adjustment knob, for adjusting the flow rates of air, nitrous oxide and oxygen. Airway pressure gauge, measures instantaneous airway pressure during ventilation. Pipeline pressure gauge, measures central gas supply pressure. High precision vaporizer, maximum 2 position. We can provide 4 kinds of vaporizer for option, halothane and fluorane, sulfurane, sevoflurane. ACGO connection port. ACGO switch. Oxygen flush. Breathing circuit. Breathing bellows. APL valve. Inhaling gas connector. Exhaling gas connector. Manual control breathing gas storage bag connector. Carbon dioxide absorbent. Bag vent selection knob. Inhalation flapper. Exhalation flapper. Oxygen concentration monitoring port. Fan. Power switch. Power input. Equipotential terminals. ETCO2 module port, optional. Gas exhaust port. Gas source connection port, oxygen, backup oxygen, nitrous oxide, air. Display interface. Alarm information display area, the mute 120 seconds countdown and current alarm information are displayed. Ventilation mode display area, the current ventilation mode is displayed. Patient type display area, the current patient type, adult/pediatric, is displayed. Monitoring display area, the currently monitored parameter data is displayed. Click the small numbers on the right or press the shuttle adjustment/confirmation key to adjust the upper and lower alarm limits. System time display area, the current time is displayed. Power status display area, the current power status is displayed. Waveform and loop display area, the waveforms, loops, trend graphs or monitoring data are displayed. Parameter setting area, the current ventilation setting parameters are displayed. Click this area or press the shuttle adjustment/confirmation key to start parameter settings, and make parameter changes by rotating the shuttle adjustment/confirmation knob. Pipeline connection. Before using the anesthesia machine, install the oxygen battery first. Unscrew the cover, install the oxygen battery, and plug in the oxygen sensor wire. Then confirm that the breathing tube connections are correct and sealed. Screw tube with Y connector and director connector and facial mask. Silicon screw tube and connector and air storing bag. Setup and operation. Connecting the breathing tube to the anesthesia machine. Turn on the anesthesia machine. Set the bag vent selection knob to the vent position. Noted, select bag means manual mode. Select vent means ventilator control. It will enter self-test. First, sensor test. Press oxygen flush button, inflate the bellow. Occlude the patient end Y connector. Press confirm button on screen. Second, circuit leakage testing. Press confirm button. Third, circuit compliance testing. Press confirm button. After the self-test is finished, set the bag vent selection knob to the bag position. Then enter standby mode, click to select patient. Before other operations, we need to calibrate the oxygen concentration under standby mode. Unscrew the oxygen cell to keep it in the air. Press the menu button, select FiO2, confirm. After calibration, reinstall the oxygen battery. Set the bag vent selection knob to the vent position. The machine starts working. We can press the shuttle adjustment/confirmation key to start parameter settings, and make parameter changes by rotating the shuttle adjustment/confirmation knob. Press the shuttle knob. When the frame turns into a white dotted line, rotate the knob to change the value, then press the knob to confirm, then rotate the knob to change to the next parameter. The upper and lower alarm limits of the monitoring area are also adjusted in the same way. We also can press the parameter setting button on the panel, select the ventilation mode VCV, PCV, PSV, SIMV, AC, press confirm, set the parameter value. Finally, be sure to press the confirmation, change the ventilation mode. In this interface, we can also select alarm to adjust the upper and lower alarm limits. Typically, the parameters will be preset according to standards when you receive the machine. The doctor can adjust these based on the patient's specific needs. Press menu button, we can perform the system setting. Mode setting, change patient in standby mode. FiO2, calibrate the oxygen sensor, in standby mode. Volume, adjust the volume. Touchpad, touchscreen calibration is usually already set. Brightness, adjust screen brightness. Loops, display 3 loops. Time, adjust machine time. Language, standard configuration is Chinese/English, in standby mode. Day/night, select day/night mode. If need to change the patient, first set the bag vent selection knob to the bag position. Press standby button, select standby, restore defaults to return to standby mode, then press menu button, select mode setting, select adult or pediatric, confirm and set the bag vent selection knob to the vent position. The anesthesia machine start working under the pediatric mode. If an audio or visual alarm is triggered, press the mute button to silence it. The alarm will have a 120 seconds countdown. Manual operation. If you need to enter manual ventilation mode, set the bag vent selection knob to the bag position and fill the bag with oxygen quickly. Then, according to the actual situation, press the bag regularly for manual ventilation. After manual ventilation is completed, open the APL valve to release the gas. After use, turn off the vaporizer. Turn off the flow meter. Set the bag vent selection knob to the bag position. Confirm that the machine enters standby mode. Turn off the power. Thank you.